Welcome. Thank you for joining us again. I'm Richard Hurley, and today I'm joined by a patient of mine who had surgery a couple years ago. And so today we're going to talk about her story, and we're going to talk about what she went through to get to where she is now. So thank you so much for coming in today.
Absolutely. Thank you for having me.
Yeah. Okay. So I like to kind of get started by number one, kind of introducing folks to like kind of who you are and what surgery you had. So the surgery that we did for you was what's called an anterior lumbar interbody fusion surgery. Okay. And we did that at 2 levels. Mm-hmm. Okay. We did it at L4-5 and L5-S1. And those are the bottom 2 levels of the lumbar spine. So kind of where the spine meets the pelvis, if you will, right? Mm-hmm. So the 2 most common levels, honestly, that we operate on.
Yeah.
And so one question I had for you is, could you maybe talk about what you were experiencing, or maybe what led you to seek out spine surgery? Could you kind of walk us through like how you felt, what your symptoms were, and maybe like what treatments you had tried, that sort of thing?
Absolutely. So in 2015, I deployed to Afghanistan, and it was a lot of movement there always. And I was maybe 135 pounds at the time. And so it was all that heavy gear everywhere I went for 7 months, jumping on and off of helicopters, because that's how we traveled. The roads were considered black, so you couldn't travel on them. So I worked at the headquarters for Resolute Support, and I would have to go up to Kabul to get distinguished visitors.
And for people that at home that aren't in the military and have never deployed, how much do those backpacks weigh?
At least 80 pounds. It's so much
huge,
more.
Right?
It's a lot. It's the whole flak vest, your helmet, your bag, just the whole entire kit.
And when you travel, it's first class seating too, right?
Not necessarily.
Yeah.
We're traveling on Black Hawks.
Yeah.
And
so describe that. So like seated in that. It's
seated in sometimes a net, depending on which aircraft you're on, a net or just a hard metal seat that you are clipped into.
Yeah, so people don't understand that sometimes.
And, it's a hard takeoff, a hard land, because we were literally landing in a soccer field in the middle of Kabul. That's where I was. And then a hard landing again. So imagine I had so many visits during the week that I would be on and off those helicopters at least 6 days a week. Yeah. So all of that jarring, all of that impact would make my back hurt. And I was always doing like this type of motion, and it was really painful. Right. And at first I, just kind of shrugged it off. I'm like, oh, it's fine. It's no big deal. I'll stretch. Maybe I just need to stretch more. Then I got home and the pain just continued to get worse. And I was a typical active duty, person, and refused to go see the doctor. And I was like, I don't want to be on a profile. I want to still be able to do my fitness test and get 100 and at least try to aim for that, because if you get over 90 in the Air Force, you don't have to do it again for a year, right? So I just kind of powered through. That was my mentality. And fast forward to a year and a half, 2 years later, I deployed again. And not to Afghanistan, this time was to Saudi Arabia, but it was still carrying all of those weight. And at this point I had traveled so much that I learned like only travel with what you can carry, right. But that's still a lot. That's still 3 big bags for me. And I was very stubborn, and I wasn't one of those, people that was like, oh, woe is me, help me. I was like, no, I got it. Like I can carry my own things. Right.
It's amazing how much you learn from one deployment to the next too.
Yeah. And so again, my back would flare up, and typical, like take the Motrin, and just kind of shrug it off and not really do anything about it. But at this point I was about 3 years in from my back hurting, and I was just trying to, again, power through it and not really see the doctor. I did go see my primary care physician, and she's like, well, when you come back, we'll send you to physical therapy. We'll see if we can get some stretching, maybe get some chiropractic in for you. I'm like, okay, yeah, maybe. I'm just getting a little older. That's what I chalked it up to. Not so much all of the churn while I was deployed. So I spent almost 8 months in Saudi Arabia because I was extended due to the COVID pandemic. Oh, yeah. So I came home in the summer of 2020, and I noticed when I was deployed in Saudi Arabia, when I would run, when my foot would hit the ground, I would get a sharp pain in my lower back. And I thought, oh, maybe I like tweaked something. You know, I was the queen of making excuses as to why my back hurt. I never really wanted to address the problem. I think deep down, I didn't really want to know what was wrong, not realizing that it was to my detriment in the long run. And I say that because about 10 and a half months after I got back from Saudi Arabia, I had to deploy again, this is not normal for a personnel officer. I was a force support officer. That it's not normal to do that many deployments in such a quick time. But the year group that I was in, and just given the circumstance of the Air Force at the time, it was my turn to go. And I was just one of those people that was like, hey, this is what I signed up to do. And while it was difficult, like I knew that this was what I was supposed to go do. So I went and did it again. And this time it was to Africa, and for 6 months. And that was kind of the turning point when I knew something was really wrong with my back, because again, I was having to wear the vest, and it was to the point where like my legs were going numb. I was having so much lower back pain no matter what I did. Not a heating pad, not ice. I tried every anti-inflammatory under the sun, things that ended up hurting me in the long run, like raising my blood pressure. I was taking one of the anti-inflammatories. I can't remember what it was called, but it would make my my blood pressure get higher. And so I took that for a while until I realized that was an issue. So I stopped taking that. Then I went back to Motrin, and that just really was not helpful, and it made my stomach hurt. So it was just, what could I do?
And could I interrupt? So when you came back at any point during your breaks from deployment, did you get any treatment here, like when you were here?
I did. So I went to see the physical therapist at Randolph. Well, first I started off with my primary care provider, and she referred me over to physical therapy, and they had me do these different stretches, and they had me do these different, manipulations on my back, trying to see if they could like put pressure to try to like essentially crack my back, I guess, but it would never move.
Did they ever talk to you about like just like focusing as well on like core strengthening exercises?
Absolutely. So they had me doing all of that.
Yeah, I mean, I would assume that you probably had a pretty strong core because you're able to score 100 on your.
Well, I never got 100. I got close. I got like 93s.
But still, I mean, like you did push-ups. You did things to maintain a strong core.
But also through pain. My push-ups, my sit-ups. My entire lower back was always in pain.
So you were doing some PT in between these deployments?
Yes.
But still having symptoms?
Yes.
Okay. All right.
Yes.
And then at any point, did you get any additional referrals, like pain management, anything like that?
No, it was mostly just over to the physical therapist. And the physical therapist that I had, after seeing him for like 4 or 5 months, we were having our, follow up, and he said, ma'am, you're not getting better. I think I'm going to talk to your PCM about sending you over to BAMC, seeing if we can do like an MRI on your back, because there has to be a reason why you're not progressing with all of the things that we've had you do.
So you had gone years at this point, and you'd still never had an MRI.
Mm-hmm.
Wow. Okay.
Yeah, I kind of felt like it was really difficult to get an MRI. They just wanted to chalk it up to, well, maybe you could lose a little bit of weight. Maybe you need to exercise more. Maybe you need to stretch. Maybe you need to go to physical therapy. And I don't understand why it was so difficult to get the MRI.
It's hard for me to speculate, but like usually, you got to have, number one, there's indications to obtain imaging, right? So indications meaning we need a good reason to look, right? So, if I see you for the very first time and you tell me you have low back pain, well, that's not really a good indication or a good reason to order an MRI, because an MRI is an expensive study. It takes time to evaluate it. I mean, so, not everybody needs an MRI right away, but you had something that you said in your history that would have maybe triggered me to think that you need one, and that is your legs are going to sleep, right? So, and the duration of your symptoms has been longer, right, than like 3 to 6 months. So if the duration of your symptoms plus the combination of these, paresthesias in your legs, if you're telling me those things and I'm taking a history as a medical provider, I'm like, it's probably time to take a look and see if you have something else going on other than just like maybe a muscle strain in your low back. Yeah. Okay. So, so let's, right now we are kind of like somewhere in the, after 2020, what year?
I got back from Africa in 2022.
2022. Okay.
And that was when
did I meet you?
You met me May 19th of 2023, which was approximately 10 days before my surgery, because I was seeing by the previous colonel.
Oh, that's right. Yeah, I'd forgotten about that.
He had to go on maternity leave.
Yeah,
and so
yeah,
you
I
called
forgot
me. And the
about
reason
that.
I remember that is because it was my 40th birthday. That was the day
So I
that
called
you
you
called
on
me.
your birthday?
You did.
Oh my goodness.
I was actually packing up my family and we were getting ready to go to the
That was a good thing
lake.
or a bad thing?
No, it was good because it helped me solidify my decision.
Oh, okay. So, okay. Yeah. So I had forgotten all about that, but yes, you had been indicated for surgery by a different surgeon,
Yes.
but he, for whatever reason, he couldn't do it. Oh, it was maternity leave. He was, or not maternity, paternity.
Paternity, yeah.
He was going on leave. And so that's how I got to meet you. Yeah.
Right. Well, I had received that MRI, and then very shortly thereafter, I got a phone call from that previous doctor, and he asked me to come in, and he sat me down, and he said, I know you probably don't want to hear this, but it looks like you're going to need some surgery on your lower back, because if you don't, it will continue to get progressively worse. That could lead to more complications in the future. And you're so young. At the time, I was still 39. He was like, you're so young. I think this would be a really good option for you to help relieve some of that pain. But it is a very, it's a very complicated, extensive surgery, and it's going to put you down for a little while. And I was like, oh, okay. But is it going to give me the relief? Because I was just so unhappy for the last couple of years prior to the surgery.
And what did you know about spine surgery kind of leading up to that appointment?
I didn't really know anything.
Okay.
I didn't really know anything. I mean, I tried to stay off the Google because, everything is cancer. So I tried really hard. I tried really hard not to, because then I'm one of those overthinkers that will go down the rabbit hole of like, what if this complication, what if that complication? And so I tried to do a little bit of research, but not so much that I let the anxiety overtake me, because that wasn't going to get me anywhere.
I do find that a lot of patients do use the internet though as a resource. And so I assume you probably did look at some things on the internet.
I looked at what it looked like and like what they do, and but nothing to the extent. And I really didn't know exactly what was wrong with me. I know that he explained it, but it was in such medical terms that, like, to someone who doesn't understand, even now I'm like, well, what did I have done? Yeah, I had that.
Okay. And so then let's talk about, our meeting and our decision-making process leading into your surgery. So, it's kind of a unique situation, right? I mean, you had been told that you needed surgery already. So meeting me, I wasn't really telling you anything you didn't know.
Right.
But let's talk about let's talk about, the surgery that you had. So you had to have an anterior lumbar interbody surgery, or that's the one we chose to do, was an anterior lumbar interbody fusion surgery. And I corrected myself there, and instead of saying had to have, we chose to do that because I do have a tendency to kind of give my patients a choice, right?
You did.
Yeah, I don't want to say, hey, you have to have this.
Sure.
I do feel like it needs to be like a joint decision-making process, because some people are not comfortable having surgery done from the abdomen. Some people do not want to have that done, or some people can't have that done for whatever reason, right? So there's always got to be a shared decision-making process, and I do try and emphasize that when I meet people.
Yeah.
So, but you wound up having an anterior lumbar interbody fusion. So we have an incision that we make to your abdomen. And then on top of that, we also did surgery from the back. So we did that together. Was it done all? I can't remember. Was it done all in the same day?
It was done all in one day with
all in one day.
Yeah, with Dr. Kazi.
Yeah. So shout out to Dr. Wayne Kazi. He's a good friend of mine. We go to Six Flags and ride roller coasters together.
Nice.
So we did that. And then, so let's talk about, well, I guess tell me about how you, how your surgery day went. Tell me about how your hospital course went. Let's talk about that.
So I think leading up, you prepared me very well. I had a lot of questions. I was really scared of the possibilities of all the different things that could happen with complications, because you were very frank about that. And I appreciated that, because you didn't sugarcoat anything for me. You said this has every complication to include death, which is not what you want to hear on your 40th birthday. But at the same time, I knew the state that I was in, and I knew that if I didn't do this, I probably would continue to deteriorate. And so the day of the surgery, I went in, I'm very, very into my faith. And so I just prayed about it and basically left it in your hands and Dr. Kazi's hands. And I went to sleep, and I thought it was going to be, we had talked about possibly doing over 2 days, because we weren't sure what that was going to look like. But from what I understand, when I went in, you guys went in through my abdomen, and then realized that there was nothing there really for you to fix through the abdomen. So you had to basically flip me over and do the back side and put the cages in. And so that was Not scary because I had already mentally prepared myself. You know, I have a really strong husband who was there for me, was like, hey, this is like, it's going to suck and we're going to get through it. And you're doing this so that you can have a better quality of life for the kids. Like, I want to see you smile again. Like, it makes me a little emotional because I was not in good spirits. I was not. Yeah. It was really hard. And that surgery day, for as scary as that was, like, it gave me such a better quality of life. It gave me such a new lease on life. And it basically was like a reawakening for me. Like, I don't have to be in pain anymore. And yeah, it's probably going to be hard. And that surgery day was hard because I woke up and coming out of anesthesia was fine. But, you know, I had to have some blood given to me and I had this huge needle in my hand and it was awful. It was so painful and I couldn't wait to get it out. And the surgery experience, like coming out of it and being at BAMC, that was probably the best place that I could have been because every nurse there that I had cared and they were, you know, doing their best to get that big needle out of my hand. And I have like huge veins. So they're like, let's move it to somewhere else, you know, like let's make her more comfortable. And I remember setting up and, you know, my husband always tells me like, you determine like how you come out of this. Right. And I'm like, you're right. So I tried to have the most positive attitude that I can. Like every nurse that came in were like, you're smiling. Like you just had this huge surgery. I'm like, because I'm going to be so much better after this. Like it has to get harder before it gets better. And that was the mindset that I went into it with. And so that night, they wheeled me in about 6 to 8 hours after surgery. I had to go get some more x-rays, which that was probably one of the more painful experiences, like being like pushed down the hallway in BAMC. But I knew I'll never forget him. He was a nurse. His name was Dylan. He was like, I'm sorry, ma'am, hold on. And he would like, you know, try to brace the little bumps in the floor. And, it was, you know, when you're in the hospital, you don't sleep, you know, everyone's coming in to check on you. And I felt very cared for. And I remember you saying to me, as soon as you get a chance, when you feel ready, like you need to start walking. Mm-hmm. I was walking, I was making circles and laps. The people at the desk, the nurses were like, wow, like, I can't believe you just had that surgery. I'm not, like I said, one of those woe is me people. Like I wanted to do what you said, get out of there, get home so I can start the recovery process.
And the research shows the patients that will, you know, step out of bed day zero of your operation. So the same day of your surgery, do better. Yeah. Right.
I did.
Yeah, you did. And then, all right. So from a pain standpoint, was it kind of what you expected, worse than you expected? What was it like?
It was not fun. It was worse than I expected.
Okay.
It was really painful. Like moving hurt the most. The whole just because I had to move my body as one solid unit. I couldn't just like normally you don't even think about it when you don't have those problems. You just twist and bend your body any kind of way. But I had to move my body in one certain unit and like I was glad that I had like arm strength because I would like lift myself up to get pillows behind me to try to help take some of the pressure off. So it was pretty painful the first couple of months, especially trying to sleep. I tried every different combination of sleep pillows. I ended up sleeping in a zero gravity chair for the first 2 months, which was really helpful because it took all that pressure off and you're not really trying to get in and out of a bed.
I've seen one of these before.
It's like $100 chair on Amazon. Yeah. And I had bought all these expensive like body pillows for surgery and
return. Zero gravity chair on Amazon.
Yeah. It was $99, got delivered like the next day. And I I like laid in that chair, kind of propped like this. And that was the most comfortable, restful sleep that I got that whole time. Good. And
good to know.
Yeah.
Okay. And then, all right. So then do you remember how many days you spent in the hospital?
It was very short. I got to go home like day 3 after surgery. It was not a long stay because I was moving so much. And they were basically like, hey, once you can use the bathroom on your own and once you feel good, you know, and once your vitals are good to go, we'll let you go home. Yeah.
So we do, after anterior lumbar interbody fusion surgery, we do like to make sure that you're passing gas, right? So we do that because you can have something called an ileus, which is kind of where the transit of food kind of slows down or stops. Yeah. So we like to make sure that you're passing gas. And then we like to make sure that you're able to urinate, right? We don't want you to have any issues with urinary retention. We like to make sure your pain's well controlled. And you know, your vitals all need to be good. Your blood levels all need to be good because you're at risk for anemia, from bleeding around the site. So we do like to make sure all those things are good. And so, so it sounds like you kind of met those milestones or met those, important objectives to discharge, and then you went home. But then let's talk about what happened after you left. Cause I remember you had a complication. So let's talk about that.
I did. So I got home, and the first couple of days were hard, as to be expected. I tried to keep on top of my pain medication, but I'm also not one to take a lot of the narcotics. So they were making me not feel very well. And so we had put me on some gabapentin, which I kind of slowed into that. And it was probably around day 5 that I noticed I had this huge pooling, like I didn't know if I was constipated, if I had to go to the bathroom, but it was just slowly growing, but it felt like watery. It looked like a dinosaur egg on the side of my stomach. And I was still trying to be active. So I was not bedridden. I mean, when I got home, I wouldn't lay in that chair or in the bed or on the couch. I was walking around. I was upstairs in my bedroom because I didn't want to go up and downstairs right away, right after surgery. So I kind of felt like I was getting cabin fever because I was in my bedroom. I have a pretty big bedroom, but I was just making circles and laps in there, all day long. And about day 5 was when I was like, what is going on here? Like, something's not right. And I remember I was like, maybe I just need to drink prune juice. Maybe I need to go to the bathroom. Like, nothing was making this what I don't even know what it was. It was like a fluid filled sac on the left side where that incision was. Just, it was growing and growing. And I kind of looked pregnant from one side. It was really weird. But I, thought, okay, maybe this will go down again with me. Like, no, it's fine. It's fine. I'm not in too much pain. Like, maybe it will go down. About another 5 days after that. So this is maybe 10-day post-op. This thing's getting bigger. So I went to get a lymphatic drainage massage with my friend Sherry, and she was like, Maribel, it just feels like water. It feels like fluid. Like, I can do the lymphatic drainage, but if there's a lot of lymphatic fluid and they're like, this isn't going to help. I'm like, okay, maybe I need to go to the doctor. She's like, I think you should go to the doctor. So that's when I called and made the appointment. And they brought me in, and they're like, okay, we need to figure out what it is, because y'all weren't sure if it was urine, if maybe my bladder was nicked, or what it was.
Yeah, we didn't know.
Yeah, right. And so it turns out, after we did a CT scan, which you were not really happy about because you're like, I don't want you to get all that radiation.
But we needed to.
We need to do it because we need to find out what it is.
Yeah.
And it turns out there was a collection of fluid near the incision site that needed to be drained.
Well, yeah, that's a treatment for it, right? So sometimes if the fluid collection is not, too big, then we use cold compresses, an abdominal binder, things of that nature to try and help, compress the area so it doesn't continue to expand. If it's big, then, sometimes the treatment options differ, right? And so in your case, I remember I saw you, I wasn't sure what was going on, but you showed me your abdomen. I was like, that doesn't look normal.
Yeah.
So let's get a CT scan and see what's going on.
Yeah.
And then I remember you came right back, and I was like, oh, you have a large fluid collection in your abdomen.
Yeah.
So then we sent you to see interventional radiology, and interventional radiology was able to put a drain in, and they sent that fluid for some analysis, and you got to keep that drain for a little while, I believe.
Yeah, I had it for a little under a week.
Okay.
But I watched them drain it because I was awake. They numbed the area, but it was 2 liters of fluid, and I was like, that was all. It was a lot of fluid.
Yeah.
But I'm glad that I was able to.
That is a complication that can happen with this surgery, right? So you can have fluid collections that develop. I mean, they can be blood, right? You can develop hematoma. You can have a seroma. You can injure the ureter in the approach. So the ureter is the connection between the kidney and the bladder. And that's why I was like, I don't know. It could be. I don't think so. But we never say, no, it can't be that. I mean, anything's possible. So, yep, you could have that. You can have a lymphatic drainage, right? So you can have fluid from the lymph system that spills out into the abdomen as a result of this procedure, because sometimes we have lymph nodes in that area, and we have to usually coagulate those to get to the space. And so sometimes those can leak. We try and clip them when we do the surgery so that doesn't happen, but it can still happen, right? I mean, a clip can slip off.
Sure.
So there's any number of different things that can happen, right? Yeah. So unfortunately, you had a complication. Put the drain stayed in place, fluid output went down, and then what happened?
And they basically, I went back and they took it out and they're like, oh, okay, it's, not coming back. So they took the drain out, gave me a little tiny, close it up. And they're like, you'll be, good to go from here on out, hopefully. I'm like, oh, okay. So I went, and then I just went back to doing what I was doing before, which was just being very mindful of the way that I was getting in and out of bed or out of my chair, and using the spinal stenosis that I had. What was that thing called?
Yeah, so we didn't really talk much
spine
about
stem.
Yeah, so
right?
we didn't really talk much about your diagnosis kind of leading up to the operation, so maybe I should have done a better job of that, sorry. So you had a couple things going on. So in terms of your diagnoses, you had spondylolisthesis. So spondylolisthesis means that at L5-S1, in the lowest segment of your low back, your vertebral bodies just didn't line up perfectly any longer. So you had a spondylolisthesis, and it looked like it had been present for quite some time because there were, kind of remodeling changes that had happened to the end plates at those levels. In other words, that slip had been there for so long that the bones had started to change shape as a result. And then you also had pretty severe foraminal stenosis, or we call that stenosis in the low back at the foramen at that level. So in other words, sometimes when the vertebral body slides forward, the foramen can also get closed down. And that's probably why you were experiencing that, numbness in your legs. And then on top of that, at L4-5, you didn't have a spondylolisthesis there, but you did have severe spondylosis, meaning that disc space as well did not look good. You had severe degenerative changes to the disc at that level. And so you also had some, a phenomenon at both levels called vacuum disc phenomenon. So when you get a CT scan, you could see air in the disc, which is not normal. I mean, you're supposed to have water in there, not air. So, I mean, you had really, advanced degenerative changes for, somebody your age at those two levels. And so that's, and then you also had like the other like MRI findings that we see in patients who have low back pain, right? So you had modic changes at both of these levels, meaning that the end plates had, inflammation, chronic inflammation that had been occurring there for a long, long time. So, I mean, you had a lot of reasons for why you had pain. You had a lot of reasons to explain your symptoms. You had a lot of reasons to, justify having surgery.
Sure.
And so, okay, so we got through the complication, and then let's talk about, kind of, I don't want to like fast forward to like how you're doing now, but I kind of do, because a lot of times patients are like, kind of caught up in, how you're going to feel, now.
Sure.
But so like let's hear how you're doing now.
So I remember it was November, 6 months after my surgery, and you cleared me to start walking at the gym. And you said, I think it'd be a really good opportunity if you would walk at the gym. You don't have to go fast. You don't have to go uphill. Just start walking. That was the beginning of my transformation. When I had my surgery, because I was in so much pain, I wasn't really taking care of myself the way I probably should have been, because I was not coping well with all of that pain all the time. I mean, I couldn't even stand up for 30 minutes. Without having to sit down or shift my weight back and forth. I was just miserable for years. And so,
you're talking about before surgery or?
Before surgery.
Yeah, okay.
And so when you told me November of 2023 that I could start working out again, I took it slow, but I started doing things that I could control. And I started walking on the treadmill. I started lifting weights, light weights, and then when I went back a couple months later, you're like, hey, your spine is fused, like you're good. Obviously be careful with like your form and things like that, but go for it. And that was the springboard for me to do so many things. Since I've had that surgery, I've lost about 55 pounds. I am very fit. I work out 5 to 6 times a week.
Yeah, and what's this workout you do that you were telling me about?
Shout out to Burn Boot Camp. I go to Burn Boot Camp, and it is
Burn Boot Camp?
Burn Boot Camp. So it's a
Where's
chain,
that?
but they have one in Stone Oak. That's where I go.
Oak? Okay, so Burn Boot Camp. And what do you do at Burn Boot Camp?
So it's a 45-minute high intensity workout, and it focuses on, some days it's whole body, some days it's metabolic conditioning, some days it's athletic conditioning, some days it's lower body, upper body. It just depends on whatever they have scheduled for that day. But it's 45 minutes, a group workout where you have a trainer that will explain to you your circuits. And then if you are not doing your form properly, they'll come over and like kind of get like one-on-one training, but it's 45 minutes of going nonstop. And you are crushed at the end.
How many times do you do this?
Well, it depends on how motivated I am, but I try to at least go 3 to 4 times a week.
Good.
And the times that I am not there, I'm going to my other gym, Anytime Fitness, where I'll walk uphill. I think I told you about this on one of our visits. I do the 12-3-30, like the 12 incline, 3 miles an hour for 30 minutes. And that's a good walk. And I do that at least twice a week. So I could not say that I would be able to do this had I not had that surgery. I was nowhere near where I am now in 2023 because I was in so much pain, and I knew that the surgery was going to be risky. I knew there would be complications. A lot of people say don't do it. For example, my mom was like, I don't think this is a good idea. It's so close to your spine. There's so many things that could happen. My sister, who's a nurse practitioner, was like, you're in so much pain. Like, you're making everyone miserable. You need to do it. And so after we had that really frank, candid conversation about what the complications and risks were and how you couldn't guarantee that I would get relief, but at least it would be something. Like it was, you made it my choice, which I appreciated, because I don't know if you remember, but we were on the phone for 2 hours. It delayed me going to the lake for my birthday, but it was important because that was the no kidding definitive moment.
I talked to you for 2 hours.
You talked to me for 2 hours on the phone. You went through every single complication.
I don't remember that, but that's good.
You broke it down for me, and it was my first time meeting you over the phone. And
that's right. I do remember that now. Yeah. Because I had kind of inherited you, and I was like, okay, I don't really know this person, so I need to get to know them.
And so we talked for 2 hours, and I'm so grateful that I did the surgery, because where I'm at today, it's I don't even know how to explain it. My quality of life is so much better. Okay. Sometimes I almost forget that I had the surgery because I'll catch myself and I'm like, wait, I'm still very mindful when I bend down to get things. I don't do like a lot of hinging movements. I'm very careful.
Hopefully you're squatting.
I'm squatting.
Or you're kneeling.
I'm squatting. I am. I'm not like bending straight over. I don't do that. I'm very mindful of it.
I do try and emphasize that to patients that I meet, like when they're going to have lumbar spine surgery. I'm like, look, this is going to change your life, right? So, I mean, like, it doesn't matter how big or how small the surgery is. You should definitely, at some point there was probably poor form that led to this problem that happened, right? So we're going to have to relearn how to do things again, and we're going to have to continue that for life, right? So I usually try and demonstrate, I'll throw something on the ground and I'll ask a patient, okay, pick that up. And then when they, when they bend over, I'm like, hold on, stop. I want you to squat down, or I want you to kneel down and pick it up, and I want you to keep your back straight. And so, it's something that you have to change,
but I think it's it's definitely a learned behavior that you have to change, right? Like you just said. But I think when you see how good you feel after, you don't want anything to mess that up, So I was really weary. Even now at Burn, like when I go to the gym, like I modify on some things just because I don't want to do like the thrusting things, I'm like very careful, but I'm still able to do all those things. And that's what I love about going to Burn as well, because they allow you to modify, and you never feel judged. You're like, hey, do what works for you. Like you're here, and that's half the battle. It's just getting here, right? Because it's hard. It's not easy. And a lot of people will go and then they'll quit, and I've been pushing through it, and it's not been easy, but having the surgery, like I said, kind of gave me a new springboard to reshape my life and reshape what I wanted for it. Because to be quite frank, I was not in a good place, the years leading up to my surgery. I wasn't, and I'm glad that I did it. I'm glad that I took the risk, and I'm glad that I leaned on my faith to allow me to go into it without having such anxiety, because I knew that no matter what happened, it would be okay on the other end.
That's good. That's great. Well, thank you for coming in today and talking to me and sharing your story.
Absolutely. I'm very grateful for the opportunity to share this with future patients and let them know that, it is scary, and it's not going to be easy. It's not a cakewalk. It's not like, I went and had the surgery and now I'm great. Like, it's been 2 years, but I've also had to put in that work. And I like your story too, because complication, right? So a lot of people don't like talking about complications, particularly, people in my, I'm just saying, particularly people in my field. But I think it's actually super important that we talk about it, because if people only hear the negative aspect of a complication, they don't know that there's a positive, there's something that can actually happen that's positive later on, despite having a complication, then they don't necessarily know. Now, there are some dreaded complications, right? If you get a pulmonary embolus, that can be horrible, right? That can be fatal. If you get, if you have a stroke after surgery, that can be really, really bad. So I'm not trying to sugarcoat things, and I'm not trying to say that, surgery is safe for everyone and that, complications aren't a big deal. They are a big deal. But I also think that, if we recognize things promptly and we try and, address them in an efficacious way, that you can still have a good outcome. I think so. Yeah. I think so. I really appreciate the opportunity to talk about this.
That's great.
And hopefully it helps someone out there that is like me, unsure, but they know that they want to have, that pain fixed.
Yeah. Well, it's funny you say that, because I always tell people on this podcast, I don't fix you.
You didn't fix me, but you helped me.
We do help make you better. Right?
Yeah.
So like, I'm not trying to like harp on that, but like, I do try and tell people like, look, I can't turn back the hands of time.
Absolutely.
Right? I'm not God.
Yeah.
I mean, there's, great stories in the Bible that I read about in church, where people do get fixed, but I'm not that person. I'm just, just a surgeon trying to help make you better.
And you did help. And I appreciate that. Yeah. The pain that I used to endure and how it impacted my life, I didn't see it till I was a year past it. The fact that my husband tells me that I'm so much more present now, and that he sees a smile on my face and I'm enjoying life, and I'm the soccer mom and I'm out there and I'm able to do all these things that I wasn't able to do before. That is a testament to the fact that, the work.
We should probably give a shout out to your husband's as well. What's his podcast?
The One's Ready podcast, if you're interested in special warfare.
There you go.
Yep, they're on YouTube, Spotify, Apple, all the places you can find a podcast.
One's Ready.
One's Ready.
Okay, cool. Again, thank you so much for coming.
Thank you.
Yeah, really appreciate it.
Yeah.
All right. Bye. Thanks, everybody. I hope you enjoyed this podcast. Bye.